want to thank everybody for showing up today. I'm sure we'll have some more that'll come in as we get to going. Here we are once again for our third Thursday special guest speaker, and man, we have a powerful team of guests that are here today. Before I allow Rod to introduce our guests. First, I want to take an opportunity to introduce Jerry Rayner. Jerry is the state conservationist for Indiana, and he's been very helpful with a lot of the things that we've been doing. He's helping us with the urban ag part of things. And so a lot of the things that we'll be looking at, even probably possibilities with our special guest tonight, can have something that really can add to the urban ag. And so just wanted to recognize him. Jerry, if you want an opportunity to say hello, you got that chance.
All right, Mr. James, thank you for the invitation, but I want to thank you guys for the opportunity just to speak to the group. I know Mr. Face, who is a member of our staff. As you introduced me, I am Jerry Rayner, state conservationist with the Natural Resources Conservation Service. 30 plus year career with the agency and the Conservation Partnership. I've been in Indiana going on 3 years now. North Carolina's home for me, but I've lived across the country, several different positions. So just glad to be here. And at a state fair event, met Mr. Jameson's wife, and she stopped me to say, now that I know who you are, I have an issue. I need your help. And we were able to get that resolved very easily. Just it's all about communication sometimes.
Yeah.
Ever since then, made a few visits down to the Evansville area. Got a chance to visit Lyle Station and take a tour of that area as well. I wear mine all the time. I do appreciate it. But gentlemen, I know Mr. Faison has made you aware of our agency, our responsibilities, what we're here to do. And we're here to assist you in your needs when it comes to agriculture, small farming. We typically operate on big scale agriculture operations, but the agency has been tasked with urban conservation. We are the lead agency when it comes to urban and small farming. So with that title being placed on us, it would be wise of us as state conservationists to actually move in that direction. So we've started putting things in place. Want to make sure we have people available that can assist you. And I will let you know this is an area for you that will be unfamiliar as far as working with the agency. Now that you know who we are, ask your questions. At any time, if you're visiting one of the local service centers, get to the heart of your questions. Make sure they get to you and visit the landscape, walk and talk with you about your needs. Because not only our bread and butter is technical service, that's that service that we walk the landscape with you, help you recognize those concerns that we can help you address. And then we have the financial part of our agency that then, depending on what we identify, we may be able to assist you financially in those areas. But I've been with small groups in the past. You may not know what questions to ask. So that thing we always hear about, there are no dumb questions. Trust me, if you don't know what to ask everything until you get your answer.
All right.
I realize the group we're visiting with, and we're not only small farm, but minority as well. We're here to try to ensure that you receive the level of service. So I appreciate Mr. Faison and Mr. Jones being a part of the group. And at any time, gentlemen, I am available. They're probably more readily available. But if you need me for anything, Mr. Jameson and Mr. Faison know how to reach me. If not, just Google me. You can probably find me pretty quickly. But thanks for the opportunity just to introduce myself. If you have any questions for me, I know I'll be with you until about 10 minutes to 7. So thanks.
Thank you. Thank you. So with that being said, like I said, I just want to take the time to thank him. NRCS, like I said, they're dealing with the urban ag. They are also the branch that deals with the QUIP, which is the high tunnel and things of that nature. And so if Frank was on here, Frank would tell you that I've sent people from all over the country to get assistance on what to do and what to say. So Jerry is somebody like I said, he's at the top of the state, and we reached out to him, and he was someone that was more than ready to jump in and fill the gap on things. And so with that being said, I just want to thank him once again and thank Faison for being on. I'd like to take time right now to introduce our new special guest speakers for the day. It was not by happenstance that these individuals came on. I think it was divine. They have several great products. I've sampled their coffee, and I was sharing with them earlier. If they ever need a spokesperson or a testimony, I'll be more than happy to give it. I drink coffee every day, and what they have is by far the best. And so I'm gonna give the honor of introducing him to Roderick. He's been part of our group now for a couple of years. Met him a couple of years ago at the National Black Farmers Association, and because he was the one that helped to make this possible, I just want to give him the opportunity, one, to thank him for the connect, and two, to give him the opportunity to introduce our special guest speakers tonight. We have hopefully we'll have three of them, but we know that two of them are here right now. So go ahead, Roger. Thank you.
Well, thank you, John, and thanks everybody for coming. And not to steal their thunder, but just want to let you guys know we have Mr. Dennis Denal, and CEO and founder of TM Biotech, which is one of the companies that he will talk to you about today, and Mr. PJ Larive, Dr. Larive. He is a PhD doctor, scientist, and I'll let them introduce themselves a little further. And he is the co-founder of TM Biotech and the rest of the companies that they will share with you today. So without any further ado, Dennis, I'll just turn it over to you and let you take it from there.
Okay, thanks so much, guys. Thank you, gentlemen. Thank you, John, for allowing us to speak today to let you guys know about the numerous projects and products that we have that are really groundbreaking and breakthroughs in technology that will really reshape the way we think about the number one, the CBD space, and then number two, the coronavirus / COVID-19 space. But PJ, why don't you go ahead and say a couple words before I tell them about your vast and impressive resume.
Well, I appreciate that. Actually, John and I were speaking earlier before everybody jumped on, and he was ranting and raving about our coffee, and I was telling him, where we were and how we had to get to that point. And John, again, I appreciate you letting us speak today. And I know it's the last minute, we'll kind of jump in. And Rod, I appreciate this. And I think I'm in Louisiana. Dennis is a Louisiana boy also. He won the coin toss, and he's over there in California living the life. And I'm here running the factory, the warehouse, and the manufacturing, the laboratories with my crews here. So we have so many different product lines that have flourished from agriculture. We're 100% organic based, hemp derived, except for our CV19, which is in the COVID space. And I think the reasoning why we are led in here from Rod through here is because we are looking to bring our hemp farming back into the United States, and to make sure that we have proper support agricultural wise for the proper soils, the proper nutrients, so that my seeds that we've developed in lab flourish in the United States as they do where they're being grown out of the country now. And also to have a little less taxing on getting our product into the United States through customs. And Rod's been such a big help, and with that, it's amazing. So I'm going to just go ahead and turn it over to you, Dennis, and let you. I always tell everybody, if I ever need a job, I'm bringing Dennis with me because he makes me sound like Jesus.
Well, you know, the funny thing about that is my wife used our sports balm, which is, you know, and I'll get into the technology in a moment, but we're able to deliver 2,000 milligrams of CBD per serving in our CBD, where other people are putting maybe between 1 milligram to maybe 70 is the most I've ever seen. We're able to get 2,000 on her. She put it on her menstrual cramp area around her tummy and in her back, and within 20 seconds the pain was gone. So she's like, oh my God, PJ's Magic Jesus. So his nickname is Magic Jesus. So I only talk about what is true, and I'll get to that now. So my name is Dennis Donnell Jr. I'm CEO of TM Biotech, of Monet Products Inc., which is a skincare and wellness company in the CBD infused space, and Bonyamore Coffee, which is also a hemp infused or CBD infused coffee brand. So to give you a little background about what makes us different and special, it really boils down to Dr. Larive's specialization. He is a retired NASA scientist working in multiple spaces at NASA. He understands the interrelated nature of sciences like no one I've ever seen before, honestly. He worked in jet propulsion, helping a rover to land on Mars. He invented the radiant barrier that kept the radiation and heat out of the space shuttle. He was researching how to deliver nutrients to astronauts in zero gravity, and worked formerly in sickle cell anemia gene therapy, creating nanobots that went into the bloodstream, would find the errant cell and cut off the sickle, and was really months away from curing sickle cell anemia. But the government was worried about the implications of bioterrorism after 9/11, so they shut down the program. But for our purposes, his wheelhouse is in delivery systems. So we are at the core in the Monet and Bonyamore spaces. We are a CBD research and development company. And so what PJ has been able to do, he uses his nanotechnology experience and elongates the fatty acid chain in CBD. And that in that process, it makes our CBD thousands and thousands of times more potent than anything anyone has ever heard of before. In fact, we have a 50,000 milligram CBD per gram that I was able to use after a surgery on my face, after a dog bit off the tip of my nose, believe it or not, and I had a skin graft surgery. And so I went home with this product, and I didn't take any of the medicine they gave me on purpose for about 13 hours because I wanted to test the product. And when I couldn't take the pain anymore, I took the Percocet that they gave me, and within 30, 40 minutes, I was completely loaded. And I hate that feeling. I hate barbiturates. And then I felt the pain, but I was high. And then I took the Tylenol, and same pain. Then I took 20 milligrams of our 50,000 milligram CBD, and all of a sudden, 30 minutes later, I had zero pain for 2.5 hours until it hit my kidneys. It's so bioavailable that all the excess flushed out of my body, and I had to take it again. So for the week that I would have been taking these painkillers and getting hooked on painkillers, I took our CBD that obviously isn't on the market because it's too powerful, and I had no pain. So on the flip side, on the other side of that coin, the other thing that elongating the process does is it hello whoever joined. The other thing that it does is it neutralizes the carboxylic acid in CBD, which allows us to combine it with stem cells. So we use snail stem cells. We're the only company in the world that is able to combine CBD with stem cells. And as a result, if you go to our website, it's www.tresmonet.com. That's TRESMONET.com. And if you happen to look at our before and after pictures, you'll see that it helps the body it spurs healing in 2nd degree and 3rd degree burns and fresh wounds in a matter of 5 to 10 days. So whereas I had this surgery on my face, I used our serum product and I have literally no scar as a result of this surgery that I had on my face. The scars up here, I guess I can show you. There's like literally there's no scar right here where that happened. And if you know about skin facial surgeries, the skin on the face is much more delicate and thin, so it heals in a different way. It's really a breakthrough technology in that proposition. So, and then on the coffee side, because PJ is taking his NASA developed nanotechnology, it's really, he works, if you don't know what nanotechnology is, I'll give a short explanation. Nanotechnology is the science of making particles smaller. So, and it's about bioavailability. So if you think of the skin as a screen on a screen door, and you think about the particles as marbles, if you put a marble on the screen door, it's going to sit and roll off. The marble's going to roll off the screen because the particles are too large. So when you do nanotechnology, it makes the particle smaller, so it's bioavailable and it can actually get through the smaller screen portions. So he works even smaller than nanotechnology into picotechnology. So we're able to infuse our coffee beans to the center of the bean within, I think, 7 minutes with CBD or hemp extract. So it infuses and it's super potent. So we're able to deliver 1,000 milligrams of CBD per 8-ounce cup. And that's why John was talking about how much he loved our coffee. Well, number one, if you've ever had CBD coffee, everyone else is just coating the bean because they don't know how to infuse it like PJ does. And it tastes, if you think about the green and the brown, it tastes bitter. It tastes really, it's a bad taste. Well, ours, because we're infusing the CBD into the coffee, it changes the molecular structure of the coffee and it gives it a nutty, rich, velvety flavor and aroma. And then on top of that, it helps with pain. So John has back pain. He drinks this and the pain is gone. So it also helps with sleep regulation. It helps with anxiety. All the things that CBD or hemp extract from the sativa plant does, our coffee does. And then very interestingly, because we have the coffee, the caffeine mixing with the CBD, there's no jitters from the coffee. It has a sort of a quiet hum, of about 20 minutes later, and it works with homeostasis. And if you don't know what homeostasis is a balance in the body. So the reason CBD works the way it does is, as a background, is because we have this thing in our body called the endocannabinoid system. The endocannabinoid system is a system that connects the body parts to the brain through neurons, and so it's a neuron transmitter. So CBD is in our body, in our DNA, at our core automatically. So when we are able to put CBD in our bodies, it helps the neurotransmitters to transmit information to the brain. It tells the body to self-regulate. So that's why it helps with pain and why it helps with anxiety functions and issues like that, because it helps to normalize the body. So our product, when we're flooding the body with this 1,000 to 2,000 milligrams of CBD, it's giving the body what it needs, because the body can only really process 1,250 milligrams of CBD per day. So we're giving the body what it needs, and then it can self-regulate. So that's on the CBD side. So this takes us to now the COVID-19 space. So we were PJ was doing research and development on a new product, and that product was a saliva inducer for cancer patients or people who take medicine that gives them dry mouth, or for THC smokers who smoke marijuana and it gives them cotton mouth, right? So everything PJ does, he works at a subatomic level. He's not just going to go and make a mouthwash. He's going to make a mouthwash that does something new, different, in particular, based upon his NASA science. It's like having a business partner who came from Star Trek. It's really, really quite crazy. So he's working on this product, and it's working really well. And he happened around that time, the CDC China reached out to PJ and said, we want you to check all of your bottles, raw materials, and liquids for coronavirus infestation, because we source a lot of our product, a lot of raw materials and containers from China, and many from the affected area at the time in Wuhan. So we checked it, it came back negative, all was good. But over the weekend, PJ happened to leave, and this was around the 1st of March or the end of February last year. He happened to leave a slide of the intellectual property for this product that we're calling CanaClear on a microscope that was tethered to the governing body for this Chinese CDC that was checking for coronavirus infestation. So that following Tuesday, we got back into the office, and then there was an email from the World Health Organization saying, we appreciate the important work you're doing in the area of coronavirus research. And we looked at each other like, what does this even mean? Neither of us, we're not doing that. And then it went on to say that our intellectual property affects the S spike protein, and that would be the golf tee, the little golf tees around the coronavirus molecule that we've all seen a million times when we look at the news. So that golf tee is responsible for communication between the coronavirus molecule and our body, our cells. It is a link and a connector. It hooks on and then allows the virus to infect our cells, our human cells. So as it turns out, our intellectual property eradicates that spike around the coronavirus molecule, and that has to do with the involuntary coughing and sneezing. So if you get rid of the coughing and sneezing, then you can suppress the spread of the coronavirus. So that's what the letter said from the World Health Organization. It said that we could substantially decrease the spread or suppress the spread of the coronavirus. And we're thinking, wow, this is from the WHO. This is really crazy. We should probably investigate this. We have a responsibility to the world market, to humankind, to develop this. So we did. We jumped into PJ within a week had developed the product. Then we jumped into phase 1 clinical trials. They were for safety, zero problem with safety because it's all plant-based. At the time, it had CBD in it. At the moment now, we dialed back the CBD because of the regulation issues with the federal government. And then by March 11th, we finished our phase 2 clinical trials. The phase 2 clinical trials were for safety and efficacy, and they showed a 94 to 100% improvement in COVID-19 related symptoms within a 5-day period during a 14-day study. So this is symptoms such as sinus, sinusitis, bronchitis, upper respiratory infection, and flu-like symptoms. So the people who came in to the study because of the radio ad that they put out, if you have coronavirus symptoms, come and take a part in the study. Everyone who took the product got better within 5 days. Everyone who took the placebo stayed the same. So it was a double-blind placebo-controlled study, and that's what that means. It means that nobody knew who was either administering the test or taking the product knew what they were taking. And so it was a blind test. And then the placebo, half of people got the product and half of people got the placebo. So pretty much everyone got better, 94 to 100%. And so since that time, I guess in June 15th, we applied to the FDA for FDA approval. We got minute meeting notes on July 22nd, meaning they gave us a roadmap on what it'll take to get approved as a new drug under the FDA. And then in November, in August, we ran out of money. PJ and I are really financing this ourselves. And then in November, a consultant from the FDA told PJ that why don't we just enter the market as a nutraceutical? It's all plant-based. And so that's what we're doing right now. We're going to be entering the market as a nutraceutical, as an option for people who are sick now, because the vaccines that are on the market don't treat people with symptoms who are sick now. All it does is suppress well, it doesn't even do that. It tells your body that the virus isn't dangerous anymore. That's what the vaccine does. But it doesn't help people who are sick now. So our product will get people well within 5 days. And if you take our eyedropper, there's 5 different products. It's an oral solution for 5 days, an eyedropper, which is daily, a nasal spray, an IV drip for people who are in the hospital and intubated. And then we also are going to have an inhaler. So if you take the eyedropper, it will keep you from getting sick, or the nasal spray. So this is something that can be used to get people back in school. It will stop the spread because people won't be coughing and sneezing. If this gets out on the market, this is a real game changer. Or when it gets on the market, it will be a real game changer because it'll provide people an option who don't want to take the vaccine. And as we all know, our community, the brown and black community, is not particularly keen on any vaccine or any mandate from the government to take a vaccine. And I live in that world as well. I'm not particularly interested in taking it. And plus I have a very serious anaphylaxis issue. I have a food allergy that, I've almost died a couple of times. So I'm really not able to take it. So, but this provides a real option for people who are sick now. And because this is all plant-based, everything we do is plant-based. It has nothing to do with chemicals or dilutants, and so it's really important that everything we do is organic. I think that's what brings us to the table today with the Black Farmers Association, with John, Mr. Jamerson, and then also ultimately with the USDA. So it's a real opportunity to have a game-changing effect in the CBD space because we offer a much more potent, a cleaner, and a more bioavailable CBD product base than anything else on the market. And then in the COVID space, we provide an opportunity for people to have an option for treatment as opposed to languishing in a hospital taking Tylenol because there's really nothing that treats the symptoms, or an option from taking the vaccines that are really being pushed on everyone right now. So that's pretty much, I think, what we have to cover, unless, PG, if you want to add some stuff, and if anyone has any questions, we'll open the floor to that, I suppose.
Okay. And Cheryl's on now also, so if you want to introduce her.
Okay, so Dr. Cheryl Pruitt is on the line, and her also vast and impressive background. She is a PhD in education and also sits on medical boards at I forget the name of I forget the name of the hospital.
It's at the Methodist hospitals, Dennis.
Okay, Methodist Hospital in Tennessee, right?
Indiana.
In Indiana. Okay, my apologies. And then she was former superintendent of schools in Gary, Indiana. And so why don't you go ahead and introduce yourself, Cheryl, and take the floor.
Well, you did a great job of it, so I appreciate that, Dennis. And so we're just really looking at the options for people because that we know that there is a lot of hesitancy. And I apologize that you can't see me right now. But that's basically the nuts and bolts of it. We want to make certain that people, especially Black people, Black and brown people, are healthy and that there are no preconditions that exist after the vaccines are taken, basically to make certain that people understand that there are options. And so that concludes that.
That's great. And for everybody that's out there, Dr. Cheryl, she's been in our group in the past, working with us. She's worked with us on a couple of grant opportunities that we had looked at earlier in the year and last year. So it's good to have her back amongst us and everything. I'm gonna give PJ an opportunity to say something, and then we'll open it up for some questions.
Well, I think Dennis summed everything up that I was going to say, because as I was thinking it in my head, Dennis was saying it, except happy birthday, Cheryl. I heard it's your birthday. I don't know if it's today, but
Thank you so much, PJ.
Happy birthday. Yeah.
Thank you, John.
that's awesome. So, but I think where we come into play, what's so important is that bringing our farming and our techniques of farming into the United States, which Dennis didn't touch on yet, is so important to us. So we can resource here, put people to work, put farmers to work now, and generate a quality hemp. I've tested hemp in our laboratories here in New Orleans that's come from all over the United States, and I haven't found agricultural wise a product that meets or exceeds what we get. And I think it's because of it's a lack of an education on farming practices and what we've learned over the last 3 years on what nutrients to put into the soils, how to properly use urea or nitrogens to start the cultivation portion of the babies, basically. I'm fortunate that one of Dennis's really good friends there in California is a cannabis farmer, and he's a master grower's master grower. And every once in a while, when we got first started, I would pick his brain. He didn't know I was picking his brain, but I was picking his brain to get techniques not only on hydroponics but on indoor grow and farming, and he was an open book. And some of my background out of Ruskin, Florida, was tomato farming, and learning how to build a nutrient base soil to not only finish a harvest, but then to have that soil prepped for the next harvest was key into Florida farming, because of the way the same as North Carolina. I heard somebody said they were from North Carolina, and I spent a lot of time in Charlotte, North Carolina, doing stuff for NASA on the agricultural side also. And the farming techniques in so many states are so difficult to get to the Department of Ag and have them really share their experiences, because even though hemp has been around for so long, and Jerry, I'm assuming you can kind of back this up a little bit, but getting a practice of getting the same product over and over and over is not easy, because it's a money factor. Everybody's looking at how much money, how much yield can I get off of 200 acres or 50 acres. And instead of planting on spacing, they're planting on top of each other, which drains the plant and the plant sciences. And, we're fortunate, one of our partners on the Banya Moore side is a tenured Tulane professor. He's a dean at Tulane University. And his knowledge is scary. And I asked for his resume a few months ago, because I needed to share it with someone. And I think it was like 11 pages. And I mean, he's done every job at the university except president, and it's because he turned it down. So I mean, Dr. Bill is just Bill Bertrand, amazing guy. You can Google him; he's great, and we're fortunate to have him. And then, of course, Cheryl is just amazing. It's like talking to myself sometimes when I listen to her speak. But I think we're on the state side, we need to, we're farming in Thailand right now, and we're bringing the practices that we have there. Man, I'm sorry, my Great Dane must see something in the yard. Let me close the door. The farming practices there were rudimentary, and we actually sent them soil to mimic the soils that we needed. And within, I think the second harvest, they had increased their yield 70%. And every time we order a batch, and I helped them develop their laboratory for our oils for the bulk mass, I get the same product over and over. So they're really following my procedures, my ISO documentation. There's a guy from Boston University that's there that's really helping them. And the language barrier is not there. He speaks fluent English. So they listen well, but getting that product into the United States sometimes can be challenging. I mean, short of buying a jumbo jet and loading it down and having it dropped over my house, I guess would be the next step. And that's why we come to this today, is to get that that farming practice in the United States and educate. And we really need to get to a point where we're sourcing our US product today, because we're ready to go. I mean, right now we're getting down to maybe 30 liters that's left of our product. So we're going to have to either do a bulk buy from our farm, or that 30 liters is going to last us maybe 7 months at our current rate. So we're going to have to start quick, and it's spring. It's hot as sin in New Orleans. So we're ready to start something either in Indiana, Louisiana, Kentucky, Mississippi. I don't care, as long as we have the support of the Department of Ag and qualified people that can follow directions and basically do what we say, so that way we get the same product over and over, especially food grade hemp. A full spectrum hemp on some of these that I've tested are is trash. I don't know why the FDA or the USDA allows some of the product to go into either cosmetics or food grade products. But I mean, I bought a hemp product, a hemp oil from Whole Foods, and man, it was expensive. It was like $60 for like 12 ounces. It was really expensive. And I brought it to the lab, and I wouldn't have gave it to my dog. They had propylene glycol, they had some kind of wackadoodle MCT with a medium chain triglyceride in it. And, the acid count the pH on it was like 9 or 10. It was just not a food grade product. What we have is 100% organic. It's pure. We have to cut our product with an MCT because of the efficacy of it. It's so milligram per gram. We're dialing back from 50,000 milligrams to what our product, our end user needs, either 1,000, 2,000 milligrams per gram. And for the science nerds, that's a cup of coffee is, say, 8 to 10 ounces. We're delivering 1,000 milligrams per 8 ounces of coffee, simply by connecting the fatty acids in the coffee bean in a second crack coffee to the chain all at one time. So it's, Dennis, I tell them all the time, it's not rocket science, because once you've done it 300 times, I can do it in my sleep. But when I bring another scientist into the lab or into the formulation area, it's like having to retrain what people think a medium chain triglyceride is, and what a full spectrum actually is. And because the public is being fed 10 milligrams per serving, or they're using the milligram as a weight and not a strength. And for that example is Dennis sent me a photo yesterday or the day before of a 50,000 milligram CBD oil that
5 million. It was 5 million milligrams.
5 million milligrams, that's great. However, it's impossible. And after I looked at it really close, it was 2 milliliters, I think. And there's X amount of milliliters in weight. So they basically, it was a way to sell a product, and they based it off of weight instead of milligram strength. And because ours is milligram strength, we can, we send our lab reports out and our sampling when I create something new. I do it in-house to make sure that it's correct and it's bioavailable. But then I'm super biased because I know what I built. So we send it out to other labs to double check me, so I don't lie to myself, I guess. But anyway, we send it out, and it usually comes back stronger than what I originally thought. So again, we dial back just a little bit to make sure that we're not exceeding that 1,250 milligrams of CBD per serving. And digressing back, I guess where we are today is, how do we help you with the Black Farmers Association, and how do you guys help us to continue our growth as a company and to help save the world? Because I really like to put the CBD back into our CV19 COVID serum and remove, not really remove, but I'd like to add an additional layer of CBD into our formulation schedule. But especially now that we're going nutraceutical, I guess that's the question. And I'm leaving it as an open statement, but it's actually a question. How do you help us, and how do we help you?
And that's great. So I'm gonna throw this out there for you, Dennis, Dr. Cheryl, and just kind of formulate through my mind. My background was engineering, so I look at where I'm at, look at where we're trying to go, and try to throw some pieces in there. So I'm gonna throw some pieces in there on how I see a few things, and then we'll open up for questions, and hopefully you guys can run the gambit with us. So the way that I'm viewing what you're saying, if I'm understanding what you're saying correctly, one, you have a COVID-19 serum that is plant-based, and it helps to cure the COVID, the symptoms and things that go on from there. You have it in an eye drop, a nasal spray, inhaler, and other ways to get it into the body. Now, with it being plant-based, and we being farmers, a lot of our farmers are looking at avenues to be able to get into not just to grow food. We want to grow food for our people in our communities, but we also want to have it to where our business is viable, that is sustainable. And so, having a piece of the hemp and the COVID area will be beneficial. Us looking in it as from the viewpoint of what we call urban ag, which means a lot of the individuals will be using some type of controlled environment, be it a hoop house, aquaponics, hydroponics type of apparatus. We got a couple people on here, Gabe, and a few others, that those are their areas of expertise and training. And so when you guys need these special things, practices on farming. I think that we can help in that manner. I'm sure that we can get plenty of farmers that can assist you. Depends on how much you need. One, two. I think that with NRCS, a lot of the things that you guys mentioned are things that they can kind of assist in due to them being in the areas of, as I said before, the equip to be able to assist some of our farmers to be able to get the hoop houses. And then they also have areas of soil conservation and how to certain practices that they use to have beneficial soil. So I saw that that was one of the areas that you guys were looking into. And so with that being said, I think that a lot of what we would need to know is, one, how much of the product that you guys need, how stringent of a facility as far as it being protected and less contaminated. You know, what are your requirements for the things of the hemp? You know, an acre field. How many acres do you need of the products that you're looking at, and how big are you guys looking to grow and scale?
Well, it's in.
Let me interject for 1 second, PJ, because I know you're going to get into the agricultural and the needs on a science level. I want to talk about just for a second our growth needs, and it's important to understand, because our product is so potent and bioavailable. For our product holdings, our footprint is in CBD is very small, because we, you know, as you mentioned, we have a 50,000 milligram per gram CBD that we dial back, and it takes one drop, because it's so bioavailable, of 1,000 milligram CBD to infuse into a 30 milliliter or 1 ounce product. So now, so that being said, it's not 1 ounce, 30 milliliters. It's, well, 30 milliliters. How much is 30 milliliters
It's a drop per 30 milliliter. You're right.
Right. So, but that being said, what we offer is an opportunity to create. It's really an opportunity to change the way we look at CBD. We see ourselves as vanguards in the CBD space. We can be the arbiters. We can be the yardstick by which CBD is judged. And Rod can help with that. He can help with the certification. He can help introduce us to become industry leaders in the CBD space. And that's what we're really looking for. So what we can do, we can teach our farmers, we can create in the black ag community, we can create a farming community in hemp that is growing the best possible hemp in the world, right? Because of the farming practices that we have perfected over the last couple of years through our partnership in Thailand. And then we can teach these people throughout these farmers and these extractors through our processes to extract in a way that creates a more potent and a more bioavailable CBD product. And then we can help everyone to bring it to market, so we can all win, right? We don't want to just give fish. We want to teach people how to fish. We want to say, hey, let's build a consortium that can take over the CBD space. So if you want to have the best quality product, you have to come to us. There's no choice about it. We have something that nobody else has and nobody else will have, because it's coming from this real Star Trek science, if you think about it. So, just to encapsulate that, we want to bring together a group of farmers, and our needs are small, but the needs of the CBD community is vast. So let's think on a macro level and get as many people interested that want to grow hemp as possible, have them do it under our guidance and our guidelines, and then bring that product to market after being proven to be what it is, and then make everyone come to us, because if you build a better mousetrap, people are going to come to get it. If you build it, they will come. So go ahead, PJ.
All right. So, and hemp is one in the COVID space. What wasn't mentioned was the product equally works on influenza A, influenza B, and the variants, which is the mutations of CoV-2, the COVID coronavirus.
And SARS and MERS.
SARS and MERS, exactly. So it's been tested on everything. But bringing coming back into the farming, part of that formulation schedule, just thinking of three of the vitamins that's in it, we have A, B, and K. Each one of those are being sourced now outside the United States. A, as a provitamin, I'm getting it from orange and yellow pumpkins, maize, and it's coming to me as an oil. My B is leafy greens, what is it, legumes and kales. And then my K is kale, spinach, turnip greens, collards, everything that's a dark Swiss chard, and just parsley. And all of those are ingredients within the formulation schedule existing now that's all being sourced outside the US. This is all stuff that farmers can farm here for us and then process into an oil and then ship to us, or we'll ship us the raw materials. We'll build a plant and create our own oils from the biomass. But it's, some of the stuff that we're getting now it's all quality regulated food grade oils. But why should I go across the water when I can get it from a guy right there in Tennessee, or a guy right there in Indiana, or wherever? It doesn't matter. As long as it's a good quality, safe, organically grown product, and it passes the mustard inside of our laboratory. Honestly, I don't really mind where it comes from. And that's a key element. But the hemp is also such a promase. It's what we need the most to corner this market that is clearly nasty stuff that's on the market right now, and low grade, super low grade, because they're all thinking about the money. The end user is getting ripped because they're cutting back spectrums of the CBD, where it would cost us money to remove a CBV or a CBC or we remove the deltas, of course, the delta 8, delta 9s, because we don't want THC in any of our products. But a CBV, for me to remove CBV, which is part of the spectrum of hemp, a hemp oil specifically, it would cost me more money than it would be worth to remove it. So why remove it when the benefits are better eyesight, a pancreas that processes faster? It doesn't make sense where everybody else is removing and giving a shell of a hemp product, a shell of a product that doesn't connect to the fatty acids. I had a coffee a couple days ago. This it was called Death Horse. I can't remember. It was some stupid name, but it was supposed to be this great CBD coffee that was shipped to me, and I brewed a cup, and it was it didn't taste like hemp. And then I got to the bottom of the bag, and there was a little oil packet where you had to add 2 drops to your coffee. So I drank one cup, and it was like, I don't know, it was like drinking CDM coffee from New Orleans. It was really strong. So I French pressed another pot, and I added, I think, 4 drops, and it tasted like kind of like mud, like dirt. It tasted dirty. And I had my wife tasted it and she was like, "Oh, this is gross." And my daughters tasted it. It was like, "Oh, this is nasty." It was, but that's what's on the market today. And then, so I brought that into lab Monday just to see what it was, what we were adding to it. And it was about 95% of MCT, and they had a little bit of CBD, CBV, which is the, like the stalk portion. You get a lot of CBV from the biomass in the stalk. So there was no leaf product in it at all. It was just, but it was there. It was considered a portion of a CBD, but it just made the coffee taste bad. So, you know, our technology works. You know, I'm not going to try to fix something that's not broke, but we still need a good quality product.
That sounds good. We got a couple questions there, and I want to give Rod and Gabe an opportunity to ask the question. I know that Jerry said that he had a time limit on there, and we're going to try to wrap it up here pretty soon because we want to be respectful to everyone's time. So I want to give Rod opportunity. He had his hand up first, and then Gabe, and then see if Jerry has any comments or anything that he would like to share. If not, then that's fine also. But I just wanted to give him a chance before his time restraint made him have to leave. So Rod? Okay, well, Rod's thinking about it. Gabe?
I'm sorry, go ahead.
Okay, all right.
Rob was on
I was on mute.
You were on mute. Go ahead.
I was on mute. Real quick, Dennis, could you speak about the O2 levels of a patient that was they used the CV19 serum, what their O2 levels were when they were sick, and then what happened, you know, hours later?
Okay, sure. Yeah, I mentioned that we are 100% successful in helping COVID-19 infected people to get well. Some people who have not been in the hospital have been about to go on a respirator, and within 4 days they're running 3 and 4 miles. There's just two stories in hospital where they were actually tested. The O2 level on this one person was at 52, I believe, and this is a hospital in Montreal. They gave the patient, and okay, at 50, you're supposed to go on a ventilator, and you're probably not going to get off. You're probably going to die. So they realizing that the patient was mortally ill, they said, well, let's try to give it to them. They gave him the swish and swallow oral solution, and then within 18 hours, he went from a 52 to a 76 in lung function capacity, which means that all of that inflammation, all of the mucus and the inflammation that keeps people from being able to breathe was dissipated because the protein spike was eradicated. And then within another 3 hours, it went to between 92 and 96%. So they were able to release him. So within a 26-hour period, the person went from from gravely ill, likely going to get on a ventilator, and probably going to die, to being released from the hospital and saying, hey, go home and take this for 5 days. You're good. And then another story, a woman who was the head of nursing at a hospital in Baton Rouge was at, I think, 74 percent lung capacity. The hospital wasn't going to give it to them, but the nephew called us. They were going to put her on a respirator, rather. Her nephew called and said, hey, can I give this to the hospital? PJ said, well, I don't think they're going to give it to her, but if you want her to live, you have to convince them to give it to her. He spoke to the doctors. The doctors decided, okay, we're going to give it to the patient. But the patient's family said no. So the doctor, because they really cared about their co-worker, head of nursing, gave it to her anyway. And within 16 hours, she went from 74% lung capacity to 92% lung capacity, and she was asking for a hairbrush, food, and a shower, and she was released as well. So we know what we have works. It's just a matter of marketing dollars and operational dollars to get it out to the world. So Gabe, did you want to go ahead and ask a question?
Yeah, I appreciate it.
Sure.
So yeah, I just wanted to say thank you guys for coming on board and discussing your product. It sounds like you have a really great product, and I'm curious to learn more about it. I'm located in the Atlanta, Georgia area, and I primarily focus on the aquaponic side. So if you're slightly familiar with hydroponics, you pretty much can grasp the aquaponic concept fairly quickly. And I've always been interested in growing hemp, so that's this falls right into my area of interest. So I just had a couple of questions though, because you mentioned that you're currently growing in Thailand, but you have a desire to grow in the U.S. And so I guess the question is, Thailand's climate obviously is quite different than the U.S.'s climate. And that being said, were you interested in growing in a controlled space, so like an indoor space where you can control the climate and various other areas? And the second part of that question is, you mentioned you grow soil, but you also highlighted hydroponics. So the question is the desire to grow in soil, or is it to maybe grow in a hydroponic or aqueous solution where you have all
No,
the new?
that's a great question. And let me kind of clarify. The Taiwan, the reason I chose that specific farm is because of the temperature is similar to southeastern United States.
Okay.
It has a relative humidity that's similar, rainfall that's a lot more rainfall, about equal to New Orleans. So, and they're hydroponicking our babies, and then they're pulled and planted. So they're in control on the hydroponic side. If the seedling is sickly or if it doesn't look good, it gets discarded, and then they have such a large amount of area, and they're experimenting this year with the tube, um, oxygenated water rolling through these tubes. And I'm yet to see pictures of that, but it's supposed to be something new that they're trying, that they can bring the nitrogens and the oxygens up into the stem through this water filtration system that allows highly polarized oxygenated water to pass over the root prior to planting, to soil planting. I'm not that familiar with that process, but it sounds interesting. If they can control the bacteria count, I'm all in, because as long as it produces the same result in a seedling, I don't really care how they do it. And if it's cheaper, I say go for it. But they're planning on making a pretty large investment into this oxygenated water, polarized oxygenated water system that I didn't know Thailand had that much money to spend on experimentation. And I told them on the last call I had with them, they went radio silent on me for almost 90 days, and I panicked a little bit. And when they finally reached back to me through Skype, they were telling me that they were starting this new process and that we'd be highly impressed. And I'm like, okay, just where's my last shipment is all I really cared about. But yeah, I think if we start in the hydroponic in the United States, under control grow, if we can continue that grow cycle and get the same results in my final biomass, I'm all in. I don't care. I don't care how, as long as I get the same result every time, and the plant is healthy, organically derived, I'm good to go.
Yeah, and I think again, from the macro level, I feel like all are welcome in our network. So it's about creating a product, thinking about it backwards, creating a product, and then based upon that product, then creating the market for it. So creating a better quality CBD derived oil or isolate, and then going to market with that product proven out based upon what we're able to do through Rod's assistance with the federal government and the certifications and whatnot. So I think, as long as we're all working together with the same goals, we can find a way to partner so everyone is able to benefit from the association back and forth with one another.
Excellent, excellent. I'm gonna ask Jerry Rayner. Hopefully I got my mic on this time. I was talking before and nobody could.
You there? You got you.
Yes, gentlemen, I appreciate you sharing that information. And I think I have a picture here, but I'm going to take this USDA hat off for a second and ask you from a farm perspective. Because if we're looking at partnering here, and I'm stepping back to say, no, if I'm looking at this on my farm, what, as far as soils, what's optimal? I know you say you're growing in Thailand. Have you done research to say this is what we need for an optimal soil to produce? Number of acres, I know it was mentioned earlier. When I'm talking acres and return on investment, are there contracting options? I know we want to get into the business of having the product readily available, but what is the initial investment per acre that I may be faced with?
Wow.
That information and being able to share that with the farmers to say, here's the potential investment for an acre, half acre. We can split the difference there. Just as a young man asked about your hydroponics or aquaponic options, still, what is the environment you're expecting to have? I know you're looking at a particular quality of product, but when you're wanting to visit with farmers to say, here's what we need, here's how we can partner, this is a business opportunity for you. Most farmers are thinking, what is my investment per acre? What is my rate of return? How long are we talking before I receive a return? It's almost a semi-business plan that I can sit down and take a look at to say, do I want to move forward with this?
That's, I know what the soil needs, and I'm at a disadvantage, and I don't want to play this little fiddle on myself, but I had a house fire and about 3 weeks ago, and a lot of my materials is on my laptop. That is, the hard drive is out of it right now, trying to get my soil, everything I had was on that stupid laptop. But I know in Thailand, when they sent us their soils, I sent them to LSU Ag. LSU Ag came back and told me what they were lacking. And there, for our hemp, it seems to be a high nitrogen, urea. And I guess for those who don't know what urea is, it's a natural gas derived pellet. They put it in some products for horse feed and cow feed, but it's also a nutrient for soil. And it releases a very specific nitrogen into the soil that's kind of like a time release, but not really. They're little pebbles. It looks like little BBs. When we shipped those, it built their soil. I find that the South, Louisiana, Mississippi, Alabama, and Texas have a shortage of nitrogen in their soils. That's why their hemp colors and the ones that are growing cannabis, while the leaves are more yellow, it doesn't come to a full green because of the nitrogen, the lack of nitrogen in the soils. And as they add the nitrogen, the second harvest seems to be a better, in each harvest they have a better yield, and not only a better yield, a better color, and the spectrum of the hemp stays and I don't lose CBDs or CBGs. It's a full spectrum with the added nitrogen. It basically encapsulates the cell membranes within the plants and the plant science. And that's what we utilize the most is as the biomass is coming into oil production, and there's heat that's involved in that, or because we try to stay away from ethanols and alcohols completely in all of our products in the biomass production side. CO2 is okay, but then I have to get rid of that CO2 when it gets into a pharmaceutical grade product, which is another burn process that we have to do here in lab. And we're capable of doing it. But if we had, for example, the hydroponic side, and that biomass is a clean oxygenated water that you can add the nutrients into the product, to the root system, then there's no need for a high heat CO2 or high compression CO2. It can be done with cold water compression setup. And that's the same with all of our nutrients, all of our vitamin A's, K's, C's, and B's, especially B12s. On some of the B12s, we need a cold water extraction process, even down to the isolate. Because when we start formulating in lab, we're starting from dry powder. When we get our raw materials in, it's all dry powder. So we want to make sure that our hemp is in isolate form, a dry, perfect, every time powder.
So PJ, can I interject real quick?
Sure.
I'm sorry, but Jerry, to answer your question about the investment from the farmer, I'm working closely with TM Biotech and Trust Monet to help them get the biomass and hemp. I do have acreage myself that I'm farming. So to quite answer that question, as TJ mentioned, and Dennis mentioned, they're trying to bring their farming or their to the United States. So I probably could best answer that question once I get plants in the ground and start seeing what their need is. We will probably have to source some of the oils from extractors in the country first. And then once I get growing, then I could see what my acreage is bringing on, what their demand is. And then as they grow, then we can start bringing other farmers in through this group to meet their demand. But to kind of give you an idea right now of what a farmer is going to invest in, I can just tell you right now, we invested 80 grand into 5 acres, but we weren't set up for hemp farming at the time last year. That was irrigation, that was fencing. We had to cut some roads, we had to clear some trees, we had to dig a well. So I don't think a farmer who's up and running right now doing row crops would have to put that much into the investment. But just to answer your question, I could probably, hopefully, either by the end of this year, beginning of next year, be able to sit down and talk to a group like you guys and say, hey guys, listen, this is what it cost me to plant 10 acres. That 10 acres at 1,500 plants an acre or 2,000 plants an acre, this is what it yielded. This is what Trust Monet or TM Biotech is going through monthly. And then we could sit down collectively as a group. And if we can't bring that collectively as a group right now, we just have to source the oils until we can bring farmers online to start bringing that kind of poundage in, per grow, per year and whatnot. So once they grow, then we can literally grow with them, if that makes sense.
And to add on to that, our needs are one thing, but again, from a macro level, creating the oils to sell on the open market to other manufacturers as a higher quality product is also something that's what I was talking about. Now it is an idealistic thing. It's something that we plan to do. It's not set up yet. We don't have the market in place. We don't have the sales force in place. But if we know that we have access to farmers that are going to be creating in this level, in this range, we can start to put that framework together as its own sort of business plan. And that's something that we can all put our heads together on moving forward. And that can be, you know, a separate joint venture away from Tresmonet, and be, you know, a farming consortium that and an extraction consortium that is putting out higher quality CBD to sell on the open market. But that's something that we can work to develop together.
I think Darrell had his hand up also. And Jerry, did that answer your question before I move to the next one? Are you good? You need anything else?
It did, and Rod, I appreciate that, because now it puts it in the context for me, more of a cooperative effort here, that yes, the gentleman may have a smaller market, but looking to expand that market, but the co-op is there to provide the product that they need. So it would eventually be a win-win for everyone. So having that information really from a farmer's standpoint, and I'm small or large, those are some of the things I know they'll be asking. For you, it may be a little more of a cost than someone growing row crop, and just depending on operation wells and those kind of things. So I just wanted to, those are questions I had, and I'm glad you guys were able to provide those answers. So I appreciate it. Thanks.
Thank you.
Darrell?
Okay. All right. Yeah, I just want to say thank you all for coming on to the Zoom meeting here. And yeah, it's very interesting what you're talking about. It just puts me in the mind of probably about 2 years ago. We had my name's Darrell. I own Chef Joseph's Kick Sauce. We manufacture hot sauces and ginger drinks with alkaline water, you know, in Virginia Beach. And so about 2 years ago, there was a vegan fest, and I partnered with a guy who was doing, because we do ginger drinks with alkaline water, but he had did a tea and a lemonade with CBD. And it was just like a really, really good hit. So ever since then, he's no longer around, but him and I before, he, I guess, how life took him, you know, we were talking about doing a ginger drink with alkaline water plus CBD. You know, and it was like, it was a hit, lines upon lines and all that kind of stuff. And so I'll just like to put it out there that, you know, if you all, you know, are at some point, if you do get the liquid form or whatever, you know, we would like to order, you know, some samples of the CBD to be able to infuse with one of our ginger drinks with alkaline water. You know, I have a ginger lime and a ginger pineapple, and it's all health. We sell a lot of these units, and then of course, you know, we have a website and all that kind of stuff. So I just want to put that out there as well, and to get your take on what you thought about it, that particular concept, and a contact information to be able to get some samples, or, you know, we'll pay for them, you know, once it gets to that particular stage. Thank you. That's all.
Sure. PJ, do you want to talk about the water soluble CBD?
No.
Yeah.
Yeah, we've been approached by Pepsi and by a couple other larger bottling companies to formulate for them a CBD water, basically. One of the latest is a local company here in New Orleans that's a kombucha. They want to do a CBD kombucha. So I jumped in lab and actually got a great schedule for water, light fruit, as long as it is a fat fruit, like a pineapple or an apple or orange. I'm sorry, not an orange. Grapefruit that doesn't have a super high acid. Our CBD connects on the fatty acid side very easily. But it kind of works opposite of what you had suggested. You have to send us a sample of your product, your finished product that's capped and bottled and sterilized, like ready for consumption. And then we open in lab, and then we basically Petri your product and see what our schedule is with your fats and your sugars. And then we give you a completed document that says, this is what it's going to take to connect. And then you tell us your milligram strength of what you would like, or what your marketing department would like to advertise as as a finished product with CBD, hemp-derived CBD. So yeah, we're ready. I probably have about 7 different water-based ready to go. I just don't have a supply that I've made a decision on yet, because every water-based, cold press water base CBD solution that I get, they're not all equal. So my farm sends me the isolate. I can build from the isolate a water-based, but it's expensive and it's cost prohibitive to add in small batch. On large batch, depending on how large you guys are, if you're creating, say, 600 gallons a week, it would be perfect. If you're only creating 55 gallons a week, it could get a little expensive quick until you ramp up production. You follow?
Yep. Thank you very much. That answered everything. Mhm.
Sure. And then also on the hot sauce side, we have a local hot company here that's in Alexandria or Lafayette, one of the two. It's Louisiana hot sauce. And I was going to reach out to them because we actually have 2 that's kind of our staple: Louisiana hot sauce and Crystal. And I reached out to Crystal just because I happened to fry something, and I used Crystal with my CBD added, because just about everything in my house has a CBD in it, because it's my house, I can do what the hell I want. And for some reason, the Crystal, the hot sauce, and the peppers that they used are very similar to the rouge, the red capsaicin that's in Louisiana hot sauce. That's not a ghost pepper. It's a red pepper that's not super hot, but our CBD for some reason attached really easy, like within milliseconds to the Crystal. If you want to send me a sampling of your hot sauce, I can see how our CBD connects with yours, and what kind of pepper you're derived. What's your start pepper, and how do you grade your colors on your capsaicin side?
Answer. Yeah, we use a habanero base.
Habanero. Oh, really?
Yeah.
So you got hot stuff, dude.
Yeah.
You got.
No, I'm not going to talk too much. I was just going to say that what you tell, the sauces that you're talking about, I'll just say, just do a taste test.
I'd love to experiment for you and see what we come up with. You'd be surprised with. Now I know habanero is. I don't know what scale that is, but because I was looking at the scale a couple days ago when I was sitting at the house, and because my youngest daughter is working on a capsaicin pill for pain relief. So she's formulating out a schedule now, but she's using the hottest stuff on earth, and I almost said a bad word, to a point where it comes to us in powder, and you have to be in a full hazmat suit to open it, because the first time I opened it, you couldn't see when I opened a plastic bag, but particles released, and man, it was like hell. For like 3 or 4 days, my lab tech had to scrub the whole place, because those little particles, you touch it and immediately your skin would start to burn, and it was all over everything. But yeah, I'd love to experiment and see what you guys have.
That's great. We have one more question for you guys, and then we'll let you guys have a parting word from Joe Tutt, aka Joe College. You guys had mentioned that you guys use other plant-based material, and his question was, let me see if I can get to it, about being able to supply you with a Swiss chard for the oil products or for your oil needs. How can he, how can he be able to supply that? as a farmer for you guys, and he's in Texas.
The Swiss chard, I look at the Swiss chard on the K scale. So we would have to, we'd have to have a large enough biomass so we could extract the oils from the chard. And because chard is a peculiar to grab, because in Swiss chard there's A, B, C, and K. I would have to isolate out the K, and that process takes a large amount. So if I want to get, say, 10 liters, I would need approximately 20 to 30 acres of just chard to get that much oil. So the farmer's making out like a bandit. It's just a larger production facility on our side to be able to handle that much biomass prior to it starting to rot. Right. So, if a delivery comes to us with 300 metric tons of biomass, I have to be able to capability of storing it, processing it all within a 7-day period before it starts to decay. Right. So that's just a larger scale. So it sometimes chard it's just easier to purchase from a larger supply, unless he wants to invest in the oil portion and create the oils, the concentrates at his facility, and then and then sell us the oils. And then again, he's making out great profitability wise, because instead of buying from out of the country, I'd be buying right here local.
Yeah, sounds like a value added opportunity for you, Joe. So I don't know if anybody else has anything, but I'm gonna go ahead and thank you guys for joining us for Legacy's Life project, Legacy Farming and Health Group. We like, as you can see, we have a plethora of individuals, farmers, people who are into what we call value-added products and things of that nature. I'm sure that we'll be getting a lot of information here from everybody. So while we got this opportunity, I just want to ask you guys to give a quick sign off, and also share with them any contact information that you might want to share for those who might want to reach out to you.
Absolutely. I think we can get maybe Rod and you, John, to share our proper coordinates. I'll send that over, and you can disseminate it among the group. And then, I guess in closing, just to say that, we're really thankful for the opportunity to communicate with everyone, and then to let you know that, we are a new company, but because of the nature of our technology, we expect to have a very big impact on the world in the skincare, wellness, and COVID space in a very short amount of time. So, we're looking for partners across the board to work with us and helping us to build. And that's what's really all about: team building and communication. So whatever we can do to be in concert with you guys, we're happy to meet you and to look to the future together.
That's awesome. Thank you. Cheryl, I'll give you an opportunity, because I know PJ, he's gonna take up the rest of the night.
Shut up.
I would just like to add that I just really think that this is an awesome opportunity, an awesome product when we even think about the children and them going back to school and, everything that's needed on that level. I didn't mention that I have, almost 10 years of experience with St. Jude Children's Research Hospital making monoclonal antibodies, and actually understand exactly what the conversation is about. So, when we talking about messenger RNA and all of those type of things, and the ability to put what God has given us on this, this green earth, to be able to make certain that we stay healthy,
I just think that it is an awesome, other option, if you will.
Yes. Well, thank you once again, and it's good to see you again. Been a couple of
Good
weeks.
to see you too.
All right, PJ.
BJ's not here anymore.
Oh, okay.
Go ahead.
So,
For sure.
yeah, it sounds like we got Joe Tutt up there. Joe, you got anything that you want to say?
Give me some time. I'm gonna give you your oil for that Swiss yard.
All right. He said he gonna make it for you.
Beautiful.
All right. Well, hey, I want to thank you guys for the presentation. For those who didn't get a chance to hear my testimony earlier, I have tried their coffee, and hey, I don't leave home without it. That's all I can say. It is good. Rod had told me about it, and I just was going to try it because he said it kind of calmed him down. And when I did, the nerve issues that I had in my back and in my shoulder were, within 5 minutes. I hadn't even finished my cup of coffee, and I was to the point to where I was dozing off, and I'm like, hold on, I'm drinking coffee and I'm relaxed. I told my wife, I said, man, I don't even feel any pain anymore. And I was like, oh, we gotta keep at least 2 or 3 bags of this in the house. I don't care what it costs.
We have your samples coming. You're going to get a cross section of the skincare and wellness products, including the sports balm, and so you'll get to sample everything. And then I'm sending you some smaller samples to share with your circle. So Rod's going to pick that up and get that out to you.
All right. Well, that's great. And we'll be getting with our circle and passing those out to everybody. So everybody be ready to receive some samples. It's Tres Monet, TresMonet.com. So be sure to check them out. Like I said, when Rob was telling me about it, I was ordering at that moment. I was already online at that time. So once again, want to thank you from those who are here in our group. This will go out to other that are in our group. We're in several different groups that we will share this information with and move forward from there. One last question. I know that I said that was last before. On these, the product that you guys have, is there any way that we can individually have access to it, or how soon are you guys looking at that to come out on the market with your COVID-19?
This is for the COVID-19 proposition.
Yeah.
So right now, because the product is available in small batch. If any of you guys have family that is sick with COVID now, and you want to avail yourself, we can have something ready within 4 or 5 days. The protocol for a 5-day protocol is $560 because the raw materials we're buying in small batch. Once we can buy in large batch, the price can come down probably 70-75%. But for everybody on this call, we'll do a $400 number for the 5-day protocol because you guys are all friends of the family, and we want to get the word out there. And really, it's really about helping people, and doing it in a way that benefits everybody involved.
All right. Hey, I'm gonna tell you guys what. Since he's putting that out there, anybody who's interested, just hit him up and type legacy in, so he'll know that you're part of the family. And we'll go from there. So hey, thanks once again. I appreciate everybody. Look forward to working with you guys in the very near future. Wish all the success to you guys, as well as with our farmers and other members and everything. So thank you guys once again. I appreciate everybody who came on and those who had the opportunity to participate. Thank you guys once again. And
thank you.
Talk to you guys.
All the best, guys.
All right.
Cheers.
All right, cheers.
Bye.
Bye-bye.
Cheers.
Thank you.
Thank you.